Hello, and welcome to Global Scalpels, a podcast dedicated to the 5 billion people worldwide who lack access to safe and affordable surgery.
I'm Rihanna.
And I'm Taylor.
And together we're Global Scalpels.
Our guest today trained as both a medical doctor as well as a public health professional. He is currently a program officer at the Bill and Melinda Gates Institute for Population and Reproductive Health of the Johns Hopkins Bloomberg School of Public Health. In the past, he worked as a clinician in different hospitals in Rwanda before joining Johns Hopkins to pursue his Master's of Public Health as a Sumner Scholar. He is one of the first 40 awardees of the 120 Under 40, the new generation of family planning leaders, which recognizes his public health practice work through the Healthy People of Rwanda, a local nonprofit that he founded, as well as the International Youth Alliance for Family Planning that he also co-founded. His current work focuses on promoting evidence-based public health practice and youth leadership for family planning and reproductive health in the developing world, particularly the integration of men in family planning and demographic dividends in public health planning and practice. So with that, we would like to welcome Christophe.
Thank you very much.
We're very happy to have you on the show. It's going to be fantastic. So we just like to start off, often at medical school, people get asked what specialty they want to be in medicine or what they want to do. But you train both as a medicine professional as well as a public health professional. So, can you tell us a little bit about why you did this and how you accomplished that?
Thank you very much for the opportunity, and I like to share this experience because I believe every medical doctor should have proper training in public health. And the reason is there's so much we can do in the clinical setting, but we can do way more on, in public health, on the prevention aspect. And when you look at, sometimes based on the setting where you are working, however many doctors are available for the population that they have to take care of, and of course the burden of the diseases in that specific area, then it becomes clear that you definitely better prevent than treat. Of course, there will always be those people who need care, but proper prevention is definitely going to improve the lives of people, and it's going to allow people to have a happier and probably better quality of life. So, of course, in the clinic, we can treat people, keep them alive, but what does it do to them if the quality of life is not good enough, if it's not what they want? And that's really what pushed me to pursue my training in public health, but of course combine it with clinical medicine, because you also need to have that understanding of what happens in the clinical care setting to really understand, if I don't do this on the prevention side, this is what will happen in the clinical side. So there is overburden. For example, we are now facing the coronavirus crisis. It's very clear that if you are not able to control the infection rates, then you are going to overload the system, and there'll be way more deaths than actually you would experience. So that's definitely one of the motivations, not necessarily with an outbreak. By the way, I've also seen so many other events that really pushed me to really understand the aspects of public health and the aspects of clinical medicine.
I completely agree that prevention is such a key part of medicine, but yet public health is so often the aspect of a medical curriculum that's so underrepresented. For those of us who haven't really had the chance to delve into public health, what principles of public health have you found most useful in your work?
So I always like the epidemiologic triad. I think it applies to anything in healthcare. So the epidemiologic triad of where you look at the agent, you look at the host on the other side, and you look at the environment. So in infectious disease, we tend to think on the occurrence of an infection, or maybe the infection becoming worse than actually what we were expecting. That, we say that it's probably the imbalance between the host and the agent that's due to the changing environment, for example. But then you also can look at it on the chronic disease, for example. So if if you live in an area where there's no good diet, or maybe there is less food, that's also possible, then the host who is going to be that human being has insufficient food, or maybe they have like more, like not really like more food, but bad quality. But that also leads to another clinical health issue. So I tend to look at many aspects in public health in that sense. So if you have, like, for example, you are living in an area where there is very poor infrastructure, so then like transportation is bad, maybe there's no the environment that's it's going to be the policies that regulate that transportation. So if you are going to experience many healthcare issues, you have to expect very many road traffic accidents. So that's where really you have to think of, now I have to prepare my system to take care of these injured people and to make sure they are back to normal life. So if you are not able to prepare that, if you don't have that understanding, you will miss that need, like that preparedness need for your system. So that's why I look at this triad as very applicable to many things, not just epidemiology.
And this triad, it's very interesting because what we're talking about is the fact that we need to think outside just the operating room. We need to think about this triad of what's coming before, what's after, and how we all fit into this larger system. So would you mind just kind of elaborating a little bit more on this triad in the aspect of surgery, and what surgeons or people even involved in the surgical pathway along the way can do to better understand the triad for their patients, and where that they can plug in to help that out a little bit?
So when I think of like a surgeon, I think of someone who, like, traditionally, it's someone who is sitting in a hospital waiting for somebody who needs an operation, or maybe who needs a consultation. But I tend to believe that a surgeon is like definitely bigger than that. A surgeon should be part of the prevention for people to have those injuries. Like, as a surgeon, how many people can you operate? Probably like not many in a day. There are countries where now somebody who needs an orthopedic surgeon has to wait more than 8 months to get care. So if you are a surgeon and you are seeing that happening in the clinic, you definitely need to save one of your days, go to the public, see why are these people getting injured. So now, like, you have the agent. So the agent are those people who are suffering from those accidents. No, so like the agent are those perpetrators of the accident. So the, like, poor road infrastructure, maybe poor like automobile, poor kind of maybe like what kind of like the bicycle. So like the two-wheelers, so with no helmet. So those are things that are going to cause that problem that you are going to deal with. Now the host is this population. So you have kids, you have students going to school, like probably in a very crowded area. You have pregnant mothers who are going to the clinics with no proper transportation. So those are the agents who are going to suffer from those big risks, who now, because of the environment, so there is no policy to tell people you have to drive this way. This is the proper licensing process. This is the proper transportation process for these specific people. If you are nearby a school, this is how you have to behave. You have to stay at this like distance. So that's the whole environment. So now there's a lack of equilibrium between the agents and the host. Like, so like your transportation, the whole kind of whatever is in the system, and the host, the people, then in the environment, the policies, and all of a sudden you have a very crowded clinic, like a clinical setting. So the emergency room is always full, and these people like end up being disabled sometimes. Maybe you are disabled at 10 or at 15. So that's where I see like a surgeon, that voice is needed on a radio somewhere. That voice is needed on a TV somewhere. Definitely not like speaking by just operating one person, of course, doing the best and making sure these people can kind of go back to work. That's very important. But maybe in a week, you can do that for 20 people while maybe 500 people have suffered an accident. So I think now there's data that in sub-Saharan Africa, for example, if you are involved into a road traffic accident, you are like nearly like 40% likely to die. So it's not even getting disabled, it's like dying. So either there is what's the emergency services, how long does it take whoever for the ambulance to get there. So that whole conversation, definitely it cannot be held without a surgeon, because a surgeon understands what does it involve for you to actually get back to work. So what kind of injuries am I able to treat? What are those that I'm not able to treat? So if I'm a policymaker and the surgeon is telling me, okay, you know what? Now we are having 70% of the people having these types of accidents. If we are not able to stop them, then we also as doctors, we can't do anything. So then the system understands basically people are dying. It's not like they are just accidents. They are losing human power. They are losing their own people. They are putting their own people at risk. So that's how I look at the contribution of surgeons in this specific framework.
I love that ethos of taking a step back and thinking about how you can think about prevention. And I think in terms of speaking of going bigger than just in the operating room, you've gone and done that. So you've founded 2 organizations, Healthy People Rwanda and the International Youth Alliance for Family Planning. Do you mind just telling us a bit more about these organizations?
So I will start with the Healthy People Rwanda. I tend to call Healthy People Rwanda my first baby, and I don't have a second baby yet. So, so Healthy People Rwanda started as a student group. So we're working with street kids near our university, and it was really the issue that we saw. There were so many kids begging near our school. But like always, of course, you could buy food, you could do, but like we needed to do more than that. So like every day you could see there's a new kid. So it wasn't really normal to me. And we wanted to go a step further and say, why are these guys here? So we later realized most of those kids were born in single families. So basically like from teenage mothers. So then like, we're like, okay, now you can't solve this issue unless you address the issue of teenage mothers. So then we went further. We realized the issue of teenage mothers was just not in silo. So it was either because maybe they were married, but they had to divorce because of violence. Maybe they were poor, so they were involved into a transactional relationship. So then they felt like they became pregnant. So like we then went further to try to prevent, to try to help in reducing poverty. So we had a very interesting project where we would give like a pig to like each household that had a child in our program. So the idea was that like from this pig, they can make some money for health insurance, because in addition to not being able to feed their families, like they didn't have health insurance. So we kept doing that, and a pig is not really expensive. It's like $40, and we could give like 10 pigs, and in 1 year they have like maybe 30 pigs that they can give to other people. So like as students, that's probably the best we could do. And really what I learned from this is not every good program needs to have millions of dollars. And we can use the limited resources that we have and the limited ability that we have to make a change. So this organization, because of the passion that everyone had, we started as medical students. We had 11, later many people joined us. Now we have nearly 24 people. Like 3 of us continued in public health. We have 4 urologists, 2 urologists, we have 4 pediatricians. So now it's a whole like very good team of people who are able to actually do so much more. So now we have like 2 surgeons who are actually running our road safety program, because we recently collaborated with the national police to launch a nationwide campaign on road safety in Rwanda. So you probably see it on social media. It's called Gerayo Amahoro. It's like reach home safe. And yeah, so we've definitely grown, and I can see that we are making a change. So the second is the International Alliance for Family Planning. I also acknowledge that we as young people from Rwanda, of course, we can learn from our experience, we can learn from what we see, but there's so much we can learn from other people, from other cultures, and from other countries. So as I was attending a conference in 2013, and we got together as young people, we're like, this is so good that you are able to tell me about your work. This person is able to tell me about their work. I'm able to learn from them. But what happens after this? Do we leave all of this here? So we started an International Alliance for Family Planning. And that was the idea, to basically try to create a big network, an active network, that's really like centered around breeding new leaders and trying to promote collaboration among young people. So now the organization is active in more than 80 countries. And what they do is, if you are running a program in your country, you can sign up to become part of the alliance, but no one is going to interfere with what you are doing. Rather, you benefit from any resources they may have available, or even connections. So it's basically to continue allow people to run their programs using their local knowledge and their local expertise, so without interfering, but also availing any resources that they can tap into to actually like make their work more efficient or effective. So I think that approach is very, very good, because you see that many international programs, they will come like out of nowhere and like, okay, so we have a very good program. We know you guys, you need this. Okay, we have resources for you. Of course, people will take those resources and they will try to adapt whatever they want to do to the resources. But I don't think that's a proper practice of public health, because always the local people will know what they need for their community to feel better. Of course, I understand the numbers are very important, but I think people need to think beyond the numbers. People need to think that it's about people's health, it's about people's wellness. So wellness is not necessarily you having like this and this and this. It's rather the state of mind. It's rather the state of community. So maybe like our community feels better just because we have our kids playing soccer every weekend. Maybe we have weddings that like everyone is able to attend. So those considerations, like when people are implementing programs, most of the time they tend to ignore them. But I really think they are very, very important for the awareness of the community and individuals that makes those communities.
I really love this because I think this is the ethos of Global Scalpels, and why we started it is to talk about the bigger, wider picture of global surgery. That it's not just talking about what's happening in the operating theater, but thinking about the whole supply chain before and after, as you talked about the working with the road traffic police and thinking about, well, why am I seeing all these hip fractures and femur fractures in my clinic? Is because of this, right? Or helmets. And having, sometimes, unless a surgeon or someone who's seeing the end result isn't involved in the beginning of planning, then there's a disconnect. And so I really like what you're saying, and I think these are really important. And both of the initiatives that you started are super, super important, further beyond just the operating theater. And one thing that we really love about the two organizations that you started is that you decided to aim to integrate men into the family planning aspect. And that's very, very important, but I imagine it's also very culturally difficult as the male role differs from culture to culture. So can you talk about what challenges you faced with that and what solutions you have found to be very helpful in that process?
Yeah, it's very interesting that you asked that. And I think there's a very, very long way to go when it comes to integrating men in family planning. I now tend to think about family planning like on a much larger than just a contraception, which was that's how I interpreted it before, but it's way bigger than that. So planning for a family, like that's really what I call family planning now. So in some families, like men would be like, okay, I want to have 5 kids, but well, if you ever worked in the maternity ward, you don't get pregnant. You don't know what happens there. So the ability or the openness to allow women to decide, uh, I feel I want to carry 2 babies and really like be supportive. I think it's a very important step. So, like in my research, like most of like the discussion groups, we say like family planning contraceptives is a women's issue. Well, that's probably how people may see that. But then you discuss, so who decides about the number of kids? Then they're like, oh no, that's our decision. No, then it doesn't connect. So basically, even if you choose to decide, you actually like then family planning or even contraceptive should be your business because you are going to decide. So I think the understanding of what it involves to plan for a family is very important. And it's not an issue of saying, oh, I just want to have 1 kid. I want to have 10. No, that's not I think the issue is how many kids we as a family are we going to be able to accommodate and be able to provide, especially because now we are living in the world where governments are taking like as much less responsibility as they can take. And which is okay. I mean, sometimes you realize you can't support everything, but of course, it makes sense for families to really take ownership of their own families and try to make sure, however, like large family they choose to have, is what they are able to kind of accommodate. And I think that was really like one of the things I learned from my first project with Health People Rwanda, because having 10 kids and not being able to give them education, not being able to give them to what they want to achieve in life, it's really like a very big challenge for those kids. And you can see it when you are able to help them to actually do better. You will see the value they give to what you did, and you will really understand what was missing. But until they see that, they probably won't show that they need it because they don't even know those opportunities. So I think it's very important for men to understand what involves actually to plan for a family. So like having a contraceptive is one, but also understanding what are the women rights, what's the like human rights that kids will need once they grow up is very important. And that should actually like allow them to be part of that whole construct of planning for the family, or like family planning as we usually call it. Yeah. So like to be brief, it's very challenging, but I can see it also like many men are coming on board, which is good. I definitely think it's positive. And I think that we need to make sure to do better to start to engage young boys, because once boys are like they turn 14, they turn 15, that's when the power dynamic builds. So if you are able to, you want to change, you probably want to tackle it there, because that's when you want to start say, okay, you know what, the power is good. I think you are stronger, but you are not stronger to beat your wife. You are stronger to actually support. So I think changing that dynamic should start like in puberty. We shouldn't be waiting until like people are like 40 to start changing their behaviors. Where we all know how, like on our age, there's that much you can change. So, however good you can try.
They do say that, but I do think that it's important what you're saying as well about these fathers being role models for those kids at those ages, both male and female kids, just to show what the power dynamic can be like. And I really like your ethos of saying, you know, it's families planning their own families. And earlier you said communities planning for their own communities. For your organization, you kind of work on an international level, but you really follow the paradigm of act globally, think locally. So how do you find managing your organization on an international scale when you have all of these local issues and local organizations?
Yeah, it is very challenging because I think traditionally there are like people work at the macro level and people who like to work at the micro level. So I think it's a continuous effort to really continue to share with colleagues and share the thinking that like we all try to do everything to help people, but the change will always happen at the individual level. So in translating like the macro level, the national interventions to individual like health benefits or outcomes, it's a big challenge. Or even measuring that, then it's also even harder because we rarely try like find out really what caused or maybe what was the reason of the change. Maybe when you are a surgeon, you put in a plaster and you're like, okay, that worked. Without it, I know what would have happened. But in public health, it's a little bit different because maybe I can go home and use a drug, maybe a contraceptive, because I heard it on the radio, not because what you told me in the consultation room. So how do you know what really made that person use that contraceptive? So of course there are methods to try really to validate that, but I think what's needed is to try to be consistent and try to work together as public health professionals. And of course, more of integrated methods, although you may not say, okay, what I did is what caused the change, but at least you will feel that you are part of it and you are actively being part of it.
I think that's fantastic. So I think we're talking about taking local issues like family planning and then trying to put them into a framework. And I think that you do a really good job in the organization of talking about different types of the pillars. You were talking about the triangle before, and there's actually 3 pillars of your organization: the capacity building, community development, and then creation of opportunities, advocacy, and accountability. So can you talk about more about how you've implemented those and how that has kind of worked into your framework to create this family planning?
So when you look at capacity building, like, so we tend to work with young people, and young people are very energetic, or young junior professionals, but not always they will have skills, and sometimes they will have skills, but they are not given the opportunity to do it. So you can imagine when you are a junior resident and you know how to do something that maybe a consultant or the attending doesn't know how to do. So, like, I doubt you will be the like main surgeon in the room because you are the junior. So that's the whole like dynamic. Also in public health, it happens. I tend to believe that the experts in public health, they are the people living with the community, but they are rarely given the opportunity to even give an idea. So I think that capacity building really focuses on being able to speak up and being able to discredit what should not be you don't think is the right way of doing it. Because when people do not do the right thing, it's a waste of resources, and most of this funding going into public health is definitely like tax money from somewhere. So it will either be a donation, it will be either from your own community, but it's the money that should not be wasted at any point. So it's like public good, and you have to protect it and probably optimize the results. So I think capacity building for me is really allowing people to be able to look at what's happening and be able to direct the use of those resources, either through like having a voice, either through trying to push or maybe to even enhance the change. So maybe there's some work that if they have a young people who is skilled, part of that work, they are going to be more effective. So building the capacity of that young people, that person is very, very important. So what we do is to allow them to be part of international platforms, of course, do networking, develop some project management skills, proposal writing, communication skills, social media use, because as you know now, social media is the current power. So, and we've seen a lot of changes. We've seen like people joining us really shy, and maybe in a year they are the most outspoken people. So we believe that also translates into local actions. So the second thing is community development. And as I was mentioning, really trying to be community centered and breeding that spirit where you always want to be able to involve the community and take ideas from the community. So if you are a surgeon and you're in global surgery and you go somewhere and there are injuries, you can't just go and fix the injuries. You need, as you mentioned, to understand why are these injuries happening. So if there is maybe a bridge where everyone falls and get injured, maybe your surgery should be fixing that bridge. Of course, fixing whoever is injured, but you probably won't be there all the time. So maybe then as the global surgery community, really helping that community is to help them, maybe you or whatever, use the network, the advocacy. It's not necessarily giving the resources, but helping them to get that bridge fixed, you know? So that's basically like the community development aspect of it. And creation of opportunities, advocacy and accountability, that's exactly what I just said. You may not have the resources, you may not have the skills, but you may have the network, you may have ideas. So I think that ability of using your potential to allow someone to flourish or maybe to allow something to happen is really what I call opportunity.
I'm really taken by your statement about the fact that these non-profit organizations have a real duty to the people paying taxes and the people donating to these organizations. I think that's really important to keep in mind whenever this work is being undertaken. It sounds like you've got a lot of really good outcomes that are coming through your projects, not only for the people in the community that are benefiting, but also those who are taking part in your organization and building capacity. For those people in the community, though, how do you ensure that your work is translating into actual improvement for the beneficiaries of this work?
So part of it is really like making sure they are part of the design of the project. So I think I remember once we had a project where we wanted to give, so we want to give like one pig, one woman. Basically, that was the program. But then, oh no, we wanted to give goat because goat is easier. But then, like two women were like, oh, you know what? I've had two goats, but they all died in the first 2 months. And the reason was I can't just spend my whole day with something that will not even give me another goat in a year. Then she was like, why don't you give us pigs? Then I was like, what does it really mean? Like, what does she mean that I initially thought it's going to be equally important. But then she explained the whole math around pig, how it like two pigs can basically like really build the wealth of a small household. And that's $80. So that was really very much changing. And when we gave those, no one else wanted us to cover like their health insurance. At least a few of them will tell us, okay, now I can cover it. We believe also it helped with the nutrition because with the pig, they can eat a lot, but also they can poop a lot. So they are very good at manure. So it's not as like the goats. So I think it's very, very important to kind of inform, like be able to accommodate the ideas from the community. That's just like a very small scale like project. But then on the national scale, you can also think of in a country where they know there are people think like that. This is our cultural thinking. And if you are going to bring in a project like this, it won't go through because this is our culture. So it means you really need to talk to them to make sure that culture is integrated. You may think maybe this is not right, but you can't change it overnight. So that's where you start the process. And how you will see that the change is happening is, for example, if you are seeing it in the like now social media tells us everything. So we are talking about, community to have a voice. So we are talking about wearing a mask. So now you are in the community and you are doing some evaluation. So of course you have to do an evaluation, you in the community. And even those people who live the farthest in the community, they are able to tell you, oh, this virus that they won't be able to pronounce the name, they know it's deadly. And they know they have to cover the mouth. So that's how you will know that, okay, it's working.
And how do you educate the people on that? Is it a wider scale social media type um, approach, or is it through normal media streams, or what have you guys found to be most effective?
It really depends on what people use. Now, for example, in some countries, like in Rwanda, you have 90 people with phones. So definitely you have to use phones, SMS. Everyone now reads SMS. But you also know not everyone reads SMS. My dad never reads SMS. So you need to call, like to tell them, to talk to them on radio. So you need to think of like what time do they actually sit in front of TV. In many countries in Sub-Saharan Africa, they watch English Premier League. You need to get something like on that game between Manchester City and Arsenal. Of course,
football always works, right?
Yeah,
football is always the answer.
it won't be like a very good, memorable event for those who lose, but they know, oh, I remember something like at the halftime. Maybe at least it was a good message. So sure. I think it's that like strategy in involving people who know the community. Like if you've never lived in my community, you will not know that every single boy like is watching soccer on a Sunday afternoon. So then if you want to reach those people, yeah, you have to put something on TV.
So you're talking this wider net of trying to reach an audience that's outside of just the small population that we're talking about, which is really great. And one of the things that you help to do is you co-chair the big international conference on family planning, which happens every 2 years and really disseminates this message. It's more than 4,000 professionals come up and talk about family planning and population health. So you're really doing that. You're broadcasting your message, and it's a great opportunity. But obviously organizing an international conference can be very difficult and requires a lot of different skills. So can you talk about some of the non-medical skills that you are using on a daily basis really to create this and put on a large-scale international conference, and how people could cultivate some of those skills that you're utilizing?
Yeah, I think I actually like have four, like my big four that I always say. So like the big four, like the first one is really interpersonal skills, really like trying to interact with people, because as you just said, it's way many people that you can handle. So you really need to learn how to talk to people, and people have different cultures. They speak with a different tone. They speak in different languages. Like, so I have to practice all of my four languages. So if I have to respond in French, I have Rwanda, Swahili. Sometimes I will try to find some words in Spanish just to make sure that people have like are able to get what they want. So if I can't talk to them and I don't feel like I'm the right person, then I make sure my colleague can talk to them. So you don't have to put yourself in the position where you are the one always to respond to those questions. Maybe you are not the right person. So that interpersonal like skills are very important. The second is really trying to kind of stay up to date with technology. So I didn't grow up in a setting where I had a computer or everything, but that requires very high tech things to really be efficient. So if you have 4,000 people, everyone receives a message, everyone like they can update their presentations. You have really to keep up with that. Then, so communication. So you have to really like I have my role like where I would definitely try to respond to all the emails before I go to bed. So I think it's very important because somebody on the other end, and they are living in many different places. For the person, if you don't reply, for some, the wait may be 2 days. For others, it may be less than a day. So it's challenging, but you have to really keep up with that. Then openness to learning. I think when it comes to those events and activities, there are so many things that you don't know. So you have to really be able to accommodate what you don't know and allow people to teach you and allow people to actually show you how those things are done. So if somebody is in logistics, you have to let them do their work. You're basically like if you're in the theater, of course you are the surgeon, but there's the anesthetist, the anesthesiologist, like I don't know, you have the tech. So you have to let everyone do their job. If you start to interfere, it's going to backlash.
I think you mentioning surgery just leads me on very nicely to my next question. which is just to try and unify between global surgery and the work that you've been doing. And actually, it's just this perceived disconnect between public health and surgery, with public health being seen always more of a medical thing to do. We spoke to someone previously on our season who said that initially when he wanted to get involved with global health, he thought he had to be a pediatrician and that was the only way to go about it. And then actually realized later on that, no, I can be a surgeon, I can be involved in public health. How have you been able to link these two aspects of healthcare with the public health and the surgery?
Yeah, so I think the surgery aspect is a little bit actually I think it's more needed than some other fields that we have, but we probably don't know to what extent, because first of all, in some places people know, like, if you have this like type of injury, then your option is not to have the leg. So they are so used to that. It's like they don't know the alternatives. So basically, like, even the education of our community is not as much. Second, if you were really given the task to find good, like, orthopedic surgeons a lot in many places, you probably can't find many. So that also limits access, which means people don't even seek to kind of explore what else can we do with these people, because they just don't have them. So I think what I see is that on the injury prevention, there's a lot to do, but also, like, for those people with disabilities, because we also don't have to forget them. What else can we do to make sure they have a better life? Like, so it's not just like preventing an injury, and if injury has happened, then you are done. No, rather there is another opportunity to improve people's quality of life, and that's really where I see the role of a surgeon as part of that whole construct of really trying to improve people's quality of life through prevention of injury or management of like injury-related disabilities. Yeah.
Really like that. I think it's important for us to think about the whole system as a whole, and outside of just our normal realms that we normally think of. We really think that you have done a good job of doing that in your role in public health. You've won lots of different awards, anything from family planning to tobacco reduction, which may seem completely irrelated to family planning, and then all the way also from the World Heart Organization. So 3 seemingly very different aspects of medicine, but I'm sure are unified in that public health sphere. So could you tell us a little bit more about what has unified your work in these different things and what has allowed you to pursue these various seemingly unrelated topics?
But I think some of it is really like being curious of what's happening in other fields. Like when I was growing up, of course, as like a young adolescent, I used to play like soccer, and you can't play in one position. You can't play, and that's how I look at life. You can't play as a striker and feel like you fit in many teams, because maybe one striker will have 10, or maybe one team will have 10 strikers. So it means you really have to learn maybe 3 or 4 positions. That's how I look at life. So of course, if you are doing like surgery, you can't stay in that like operating theater. You need probably to do something else. At least that's how I look at it. So when I was doing medical school, I was running Healthy People Rwanda. That time it was Abandoned Youth Empowerment Project. That was just a very small project. And I was part of like the Rwanda Village Concept projects. And I think that really gave me like courage to keep up, like learning. So I would find a problem like with tobacco control. We know this is what happens. These are regulations. You go in a bar. That time it was not banned to smoke inside. Then you go to school, they say, oh, tobacco causes cancer. And even that kid who is not like born yet can also suffer. I'm like, oh, wait, somebody was smoking yesterday where I was. So the next time I go, I was always the person to tell that person, you can't do that. But like some people were not very happy with me. So then I was like, then if we have this policy, how comes I tell someone to go out and smoke, like outside, and they react like in a very like weird way? So that's really made me understand learn more about tobacco control and learn about the lobbying that goes on, like why do you have laws and they are not enforced, what happens with the like manufacturing, so everything. And that's really how I got into more tobacco control work. But that was just from a very small experience that really pushed me to move further. So that's really like, and many other things, that's how they branch on each other. And I'm like, okay, I really want to find out about this more.
So a lot of it's come down to curiosity and then also seeing a problem and not being able to ignore it by the sounds of it, which is an absolutely amazing thing to have. For a lot of people, they'll probably look at your career and think this guy's done a lot already. And if people were interested in getting involved in public health efforts, similar to the way you have, whether that's a clinician or a non-clinician, what advice would you give to them?
So I think, like, depending at the stage. So when you are a junior, you definitely need to explore. Like when you are a student, I definitely, and I've worked with like in Health People Rwanda always like has a program for undergrads. So when you have undergrads, when they come, like when we have them around in Rwanda, we make sure they see as much as possible in the country. And the idea is that we want people to be able to even discover what they did not discover about themselves. So maybe you like to work with kids, maybe you like to work with elderlies, but you didn't have the opportunity to see really the need. So we believe that by you going through different areas in our community, you may really discover what is it that you want to focus on in your public health career. So the second is, if you are like mid-career, I definitely think it's really very important to look at one or two or three problems that you really want to contribute on, like at least in the coming 2 or 3 years. And by doing that, my belief is also that you get to connect with the right people and you get to learn how to do best in that specific area. And that can grow like slow, like kind of step by step. So that's at least the two pieces of advice. And the third, of course, is trying to, like, the network is very important in public health because you don't want to do something that somebody did 10 years ago. So, like, it's also very important to learn what's working in that field at that specific time, because as we said, the resources are, of course, of great essence. So if you are able to find resources to do something, you really need to optimize the results. So that's also very, very important.
I think that's really powerful that you're saying that it depends on where you are in your training or where you are along the spectrum of researcher or whatever, that you can give, and your role might be very different, but that you can still give and make a difference no matter where you are in that sphere. Something that's very relevant to what we are all experiencing now is COVID-19 limiting travel and making it very difficult for us sometimes to do international work at this time. So what advice, well, maybe first of all, how have you managed to do your public health in sub-Saharan Africa while you've been in the States at Johns Hopkins? And what advice would you give to some of our listeners who are interested in doing global health or global surgery stuff at this time when it might be a little bit more difficult to do so since everything has to be remote?
Yeah, so I think part of it is my institution already has partners in those countries. We really like focus on locally led. And of course, I use my knowledge and my expertise to really try to kind of generate new ideas, create new projects. And I would say, really, like, if anyone is trying to do the work, finding a local partner is the first step. And making sure like the local partner is the right partner, because that's also very important. You don't want to waste your time. And I don't want to kind of say that like there are many people who would make you waste your time in public health, because I also realize many people go in public health with different mindsets. So you really need to make sure that the person that you are working with locally have the right mindset. Are these people really trying to change lives? I think that's a very important step, and verifying it is when we are talking. So if you are a good lecturer, in your talk, you will not miss talking about students. So if we talk and you are talking about public health and you never mention community and you never mention people, then I doubt really what you are doing. So that's really like my screening tool that I think I can really share. And it's not that I've verified it's validated, like the statistics may be wrong, but probably the practice may be true. So because also statistics may get it wrong. So it's a matter of precision. So I tend to think that really for me, people doing public health, they will always talk about people. As when you are a doctor, you cannot miss talking about patients. So if you're not talking about patients, then who are you doctor for? It's then I would really ask. So it's really very important for me. If you are identifying a partner, you need to find who are they working with, who are they emotionally connected with.
Yeah, because it comes down to your motivation. So why do you do the work that you do? And for clinicians, it's patients. For public health researchers, it's still people. So I think there's that common thing between surgery and public health there.
Yeah.
You've spoken quite a lot about your career. And if you had to look back now and see yourself 10 years ago, what advice would you give yourself?
That's a very good question. So I think 10 years ago, that's second year medical school. Well, yeah, that's in that year I almost got married, but it's a whole different discussion. Still, I wouldn't get married, so that's that. So that would be the same. I think really the advice that I would get myself is and there are things that I can learn from that age actually. So I think one thing is focus. So I think that time I wasn't really much focused. And that goes with not really being able to get the right mentorship. So I would definitely try to focus a little, but of course not focus too much. So you go in some places, they tell you, okay, all I know is the kidney. But guess what? The kidney doesn't just work on its own. It works with the heart, it works with the liver. So you need to understand those ones too. So that my understanding is I would focus, but not so much. I would still allow myself to have opportunities. And if I had means, I would travel more. So I think traveling has really allowed me to learn a lot. So my trip to UK, Bristol, Bath, I learned a lot. And that was way many years ago. And I still keep people that I met there, and anywhere, when I went to Indonesia, wherever I went, I've always learned something, at least one thing or two things. So those are two things that I would definitely do more of. Yeah, and maybe 5 years, I would try to streamline and focus a little bit more. And I think I would have, 5 years ago, I should have taken some good in project management courses, because I feel like management is something that we don't learn in medical school. Although we are you get into the bias that, because you see all doctors being the leaders in the hospital, but they are not necessarily the managers. So then once you become a doctor, you are in the position where you are the manager. So you are the one telling people what to do, while you've never really trained to really, how do you talk to people? How do you address needs? So project management, definitely, I actually can add it on the curriculum of medical school now, if I was chancellor. But, yeah. So,
You're talking my language. I'm actually a joint MD MBA, so I'm getting a business degree right now. And and that is for that exact reason. I felt like in medical school, I really didn't get the opportunity to learn some of the skills that I felt were really important. And actually, a lot of the things in global health was what drove me there, that I saw that things were happening around the world, and I didn't actually think they were clinical issues. A lot of them were management issues that I was seeing that was making it so the clinicians weren't able to make the impact that they wanted to do. So hoping to bridge that gap a little bit. But
that's good. Yeah. So I'm glad that what I said makes sense.
Yes. So we'd like to just wrap up with our final 5 questions. And as you know, these final 5 questions are dedicated to the 5 billion people around the world who lack access to safe and affordable surgery. And so we'd like to start off the first question with, what is the most recent book that you've read or maybe television show that you've watched?
So I'm not big on TV, but the last book I read was Six Thinking Hats by Eduardo de Bono. It's a very interesting book. I would definitely recommend to everyone.
We'll put it in the comments of the podcast so that people can look into it if they're interested.
Yeah, thanks for the recommendation. And our next question is, what's something not many people know about you or a unique talent?
So I was a fast runner. I competed at the national level in high school, and my timing was 3 seconds less than the world record. So I never got to continue with that, but I still think it's pretty cool. So my record was 1 minute 44 seconds, and I think the current record is 1 minute 41 seconds.
Wow, that is really, really impressive. Congratulations. Maybe you do have another career behind that you didn't tell us about, huh?
Maybe in the next world.
Yeah.
In the next life.
That's great. Our third question is, what was your favorite toy growing up and why?
So actually, interesting enough, I didn't have any toys. So, and probably you will see it in many sub-Saharan Africa families. Not many kids, especially in the village. I grew up in the village. I used to play football from when I was maybe 4, 5. So that was probably my toy. But it wasn't these toys and, you have to make fancy stuff. And it's pretty cool. I almost play with them now, but yeah, I'm too old for that now, probably.
No way, I don't believe that. But you're definitely a football fan. I think we've spoken a lot about football today. And our next question is, what's your favorite food?
Oh, yeah, tilapia, fish. Yeah, that's also my specialty when I cook. Yeah, I can make good fish.
Sounds amazing. I think we had another one of our episodes where with Gerald, who also said the same thing. So now I'm very curious and feel like I need to try this. I love this question because I feel like it gets to teach us a little bit about different cultures as well, and I love food, so it's nice to hear other foods that I need to try.
Poisson grillé. Yeah.
So we'll have to come over and try your specialty sometime.
Mm-hmm.
And our last question is, what was the best piece of advice that you feel that you've ever received?
Oh yeah, that's definitely from my dad. And let me think of which. There's quite a few, but I think one of them is whenever you think you are facing a hard life, always remember there is somebody facing a way harder life than yours, and who is actually wishing to be who you are, especially at that specific moment. So basically the idea that of course, keep going, and things can slow you down, but remember there are always people actually trying to catch you, but who have the luxury to actually get where you are.
It's very profound. Thank you so much for all of the wise words you shared with us today. It's been an absolute pleasure getting to hear more about football and public health and surgery, so all good things. To sort of just sum up a little bit about what you spoke about, I've really enjoyed hearing about the frameworks that you use in public health, about your journey to create these amazing organizations, and also your advice about how we can link public health and surgery whilst keeping the person or the patient at the center of everything we do. So once again, thank you so much for joining us today, and I'm really looking forward to hearing this back.
Thank you very much. And it's a great pleasure. If you ever want me to speak again, I'm very open. And keep up the good work you are doing. And I think it's a very important work. And a podcast, who thought somebody would create a podcast on public health? I'm so glad you are doing it.
Thank you so much. Thank you.
We hope you enjoyed this episode of Global Scalpels. If you're interested in learning more about this topic or the speaker, visit us on the web at globalscalpels.com or any of our social media platforms. Please subscribe to our podcast on Apple Podcasts, Spotify, Google Play, YouTube, and Stitcher to hear more great content on a wide range of topics within global surgery.
If you or someone you know is doing something in global surgery you feel should be highlighted in Global Scalpels, we would love to hear from you. Thank you again for joining us today and hope to see you on our next episode.